Welcome to this special hip and pelvis webinar where we're going to explore what is happening in your pelvis. Too often it's hard to know exactly what is going on, and sometimes we need an extra set of eyes or a fresh set of eyes to help give us some tips and tricks to help us get the most out of how we are moving. How we move through our hips and pelvis can not only affect our hips and pelvis, but also our knees, our feet, and even our core. So, first move we're going to do is we're going to look at what is going on in your hip hinge. A hip hinge is a great way to assess if you are able to get eccentric lengthening in your glutes in particular, but also in your proximal hamstring, to then spring load them to then help concentrically contract, which helps move you forward in space. If you never get length in a muscle, it is never going to be in a position to be able to help move you forward. Now we have to remember that the hips and pelvis can move in 3 different planes of motion. So sometimes when we're limited in one range of motion, we will then move through a different plane of motion to try to make the movement happen. This then affects what we're lengthening and therefore what we're loading. If we're always moving through another plane of motion that maybe isn't the desired plane of motion, or kind of becoming overly mobile in that other plane of motion, this can affect stability in our hips and pelvis. That can then also affect how we move in our hips. So let's go ahead and check out your hinge and see what it is looking like and if you're getting the most out of it. So first, what we're going to do is we're going to do it in a split stance position. This can really help you assess what's happening in one side of your pelvis compared to another and take away the instability or balance component that would happen if we went straight into a single leg hip hinge. So I'm going to have my left foot forward here and my right foot back. My right foot is acting more like a kickstand. So as I'm here, you can kind of take note to start. Do you start in a stacked position? Or is your tendency to already kind of start with ribs forward, ribs back, pelvis tip forward, pelvis tucked under? And we'll go through another exercise in a little bit to help with that starting position. But even with here, let's go ahead and take a look at yourself, recording yourself or watching in a mirror and saying, oh, as I'm here, do I need to think about kind of lifting up from that pubic bone a little bit, thinking about those sit bones floating down through the backside of my knees without clenching my butt to do that. And again, that could be hard to start. So we'll give you some separate tools to make that easier. And then what is happening with my rib cage? Do I need to think about it kind of shifting forward and lifting up? Or if it likes to be forward, do I need to think about it shifting back? I'm thinking about wanting this rib cage stacked over my hips. I'm going to make sure my stance knee is soft where that knee isn't locked out. And then now I'm going to have my hands on the front of my hips. So when I'm going to hip hinge, the front of my hips should be relaxed. I don't want to be pulling myself down from the front. I want to think about the backside lengthening. So I'm sitting back into this left glute, thinking how that's lowering me down to get horizontal to the ground, keeping that stack of your rib cage and your hips the whole time. Now, as you went to go down and sit back, did you want to bring your distal hamstring at your knee with you? Okay. This is a case where, maybe you're stealing some mobility from here to make up for the lack of mobility here. So for that person, you might have to think about keeping your knee like it is, or thinking about someone holding your knee forward as you go to sit back into that butt and really feel that spring load of, now this is going to be the thing to help push me forward or bring me back up. Sometimes using some external feedbacks of having your knee gently up against a chair that just stays kissing. So you don't want it to smush it forward, but you also don't want it to pull back and away from it, both with lowering down and coming back up. Now, the other thing we can assess from the side here is really making sure this hinge is a horizontal movement. So when people have difficulty opening up through that backside of the pelvis, they will come here and then they will turn it into a squat and load this knee and quad and drop down vertically instead of being able to shift back. The other compensation they'll do is that they'll go to shift back and then they will tuck and lengthen from their lumbar spine. Again, stealing that load and wanting it to happen from our hips, right? And we don't want it to happen above or below, but really through the glutes and the hamstring. So with that individual, they might have to think about sitting back and then almost like someone has their hand underneath the sit bone and is lifting that pelvis up and over as you sit back. You almost might have to think about water dripping off your nose, a foot in front of your left foot here to help you lift up and over and get this length here instead of it wanting to tuck back. Now, we're making sure that you're not doing that by going into an anterior pelvic tilt, right? And that's going to be that pelvis tipping forward relative to your rib cage, but thinking about this rib cage and pelvis moving as one unit. So as my sit bone lifts up, my chest is coming down to feel that lengthening here, keeping that knee over that midfoot. Now I'm in a good position. This is all spring loaded. To come back up, we want to make sure that we're using glutes and hamstrings to help pull us back up. Too often, people get this nice length to create this femur to come back into the socket. Glute is all open and ready to work, and then they come back up and they drive it from their back, or they kind of thrust and pull themselves forward here and aren't returning to that nice stacked position. So what we're going to think about here is that as I'm in this position, I'm now going to think about trying to drag this left leg back, which can be a little bit tricky when it's in this lengthened position. So again, we'll have an exercise to help with that in a minute. And then as you go to come back up, you're thinking about dragging that leg back and how that's going to pull that sit bone down, pubic bone up towards your head, and then pressing the ground away. So we're thinking about how the hips are going to come through, but also getting that length to get stacked up nice and tall. We don't want to just think about the shove forward, right? Where then I go into this kind of sway back of hips push through and rib cage push back. We also don't want it to happen where the knee straightens before the hips. So it's this kind of opposing action of hips through and knee back, sit bone down through backside of knees, pubic bone up toward your head. So now you're set up in a good position to then do your next rep from. So you should really be feeling the glutes and hamstrings working as you're doing that movement. Now I'm going to give you another view to look at how we might be robbing from a different plane of motion to try to steal or to try to make that movement happen. So I'm giving you a lovely behind view here. So now as I'm on that left leg and I sit back into that left glute, my left butt here is getting bigger. My pelvis is level. If I have tightness in the backside of this left butt, what's going to happen is I'm going to rotate, okay? This is going to keep all of this tight. So now what I might have to think about is kind of dropping my right hip and knee down towards the ground, staying centered over that left femur to help open up the backside of that left hip. And you should really feel a change in where you feel that opening in your hips. When we go to come up, you want to make sure you keep those hips square to the front. That's going to help you use your glute max as your primary hip extender. Whereas if I come up and my pelvis turns away, now I'm using more of my external rotator fibers of my glute max as well as my deep hip external rotators that often get overworked to do that movement versus trying to stay in that sagittal plane. So it might feel like you have to keep your pelvis turned to the left throughout the movement of going down and coming back up. Now on the flip side, if we have some weakness in our glute med and external rotators, we might have the tendency to drop down and collapse, or that femur might want to spin in. So what that is going to look like is as I'm here and I'm coming down, this right hip collapses down. So you can think about how this tissue is now in a lengthened position and leads to not having as great a stability on this left leg. So what you're going to have to think about there is keeping rooting down through the outside of that left hip and pelvis, making sure that left knee stays pointed straight ahead and hinging down. You might think a little bit about sucking this right hip up, but really thinking about this support here from the side as you go to hinge back and then coming back up. We can use some individual exercises to help improve the kind of starting position of the pelvis, thinking where it's like, oh, if I'm already turned out, or oh, you're one to notice that your whole leg already likes to turn out, maybe we need to do some isolated work first of finding more of that medial hamstring and that adductor to help turn your leg in to help complement this work of learning to sit back into that hip instead of turning, right? So you see how my leg is now still relatively turned out. We get that eccentric glute lengthening to help improve the alignment of my pelvis that helps with the alignment of my hip. On the flip side, you maybe need some separate glute med work of feeling that knee staying out without rolling to the outside of that foot to help create stability through the outside of that hip and pelvis. We're thinking about rooting down through the outside of that hip to find that glute med to help keep that pelvis stable for you to then be able to sit back into that glute from. Hopefully this gives you some things to think about, some tips and tricks to really feel that hinge in a different way. If it's still just feeling like there's a bunch of tension in the backside of your calf, you're not really feeling that glute length, we can always play with a prop of elevating the front of your heel on a little bit of something, and that can help kind of throw you forward a little bit so it gives you some range to sit back into. But then, like I said too, sometimes this is going too much for the kill and we need a little bit more support from other areas to then help make our body be able to move in the plane of motion that we want to move from. So let's keep going and explore some different exercises for that.